Welcome back to the Break the Cycle podcast. On today's episode, we have a very special guest. We have Meghan McCann. She is a healer. She is a board-certified psychiatric mental health nurse practitioner and owner of Velara Wellness, which is a ketamine and TMS clinic in San Diego. Meghan, we're so happy to have you.
Thank you so much for having me. I'm very excited to be here.
So excited to have this chat.
So, Meghan, what do people normally say when you tell them that you own a ketamine clinic?
Isn't that a horse tranquilizer?
Isn't that
Right.
Or like, isn't that a party drug?
Mm-hmm.
But yeah, it is a human tranquilizer, I guess. It's a dissociative anesthetic that allows, it was created for like safe anesthesia practice. So it's been used safely in hospitals since the 1970s. We use it on children in the emergency room.
Mm-hmm.
It's great for elderly people going into surgery because it raises our heart rate, it raises our blood pressure. It doesn't depress our nervous system, our respiratory rate. So it's actually safer than most anesthetics. And that's why it was created. But they have found over the past few decades that given in lower doses in a medical trained supervised clinic, with professionals, it rapidly reduces your depression and anxiety and trauma side effects.
Weren't there studies done? They started to notice this like trend with people who had gone, in the emergency room with mental health conditions, that they got better once they got out. And then they're like, oh, all of these people went under ketamine anesthesia.
The depression symptoms have significantly gotten better.
It's amazing.
Yeah.
It is incredible.
Yeah, so Dr. Crystal out of Yale is the one that kind of really helped kind of change or just kind of publish all these beautiful studies about ketamine. He was studying it for its effects on schizophrenia, and he found out that it's not good to take if you have schizophrenia as one of the contraindications because it can cause, possibly hallucinations. So they don't want for someone to go into a psychotic episode when taking it, but they did find that like 70% of people, which is huge compared to traditional antidepressants that has a 30 to 40% efficacy rate, plus a ton of side effects. 70% of people get better, and they get better rapidly within the first 1 or 2 treatments.
It's crazy.
I got off my Lexapro about 3 weeks ago now. And I swear to God, guys, like I feel like literally back in my body. I feel like I'm able to carry a conversation. I'm able to like look people in the eye, talk to them. I'm chatting with my team more and like getting to know them more. Like we have people working in Peru, Mexico, Philippines. And I'm like, I want to know more about your lives. Like, where have I been? Like, I'm like, I felt so absent-minded. And the side effects from antidepressants are like, they're so real. They're so real. And then there's people who suffer from sexual side effects and it lasts them for the rest of their lives.
I know.
Even when they're off of it.
Oh, really?
Yeah. There was a study done in the UK about, it's like a whole group of people who are like, we are not on antidepressants anymore, but our sexual libido has never been the same.
Wow.
So it's crazy. But yeah, so, okay, ketamine is good for people who are suffering from depression, anxiety, PTSD. I know some of our clinics use it for postpartum depression as well. Am I missing any of them? Are there more things off label? I don't know.
Well, ketamine, IV ketamine itself is considered off label.
Right.
Although there is a new ketamine possibly coming out as being fast tracked through FDA trials called like NRX 100. It's ketamine without preservatives. So
what preservatives?
I know.
Like,
Wait, hang on.
It's organic ketamine, actually. You can get it at Air One.
Sugar-free.
Yes.
Air One. So I get some NRX one. I don't know. I should look it up. I think it's NRX 100. So the way that this country works, so ketamine has been off patent since the 1970s. And because its original indication went through FDA trials. Like, no one is going to pay for this indication of treatment-resistant depression to go through trials. Johnson & Johnson did, because they took the molecule of ketamine. They took half of it, created S-ketamine from the S-enantiomer, and then put that through, because it's very expensive to go through trials.
Yeah.
But that's the nasal spray. So that's indicated because it works very well as well. This one, which the president of Johnson & Johnson came to my clinic the other day. It's very exciting.
Oh my God.
Wow.
I know. It's
That's
very cool.
huge.
He's the one that told me about this. But so it's being fast tracked. So we don't know what that would look like. But because it's a different kind of recipe.
Like structure of
molecules. Recipe.
Right.
Without the preservatives.
Yeah.
They're going to be able to
Gluten-free.
patent it.
Yeah.
Bring it through trials if it works. Which it will, because we all know it might be able to then be approved by insurance.
Wow.
Because right now, IV ketamine, like the two big differences that everyone asks me about, like ketamine, is it covered by insurance? IV ketamine is most likely never going to be covered by insurance because it's off-label
For depression.
for treatment-resistant depression.
But if you're in the hospital and you're like going under for surgery, they'll cover it for anesthesia.
yes, because the insurance company, because it's FDA indicated for that.
Right. For
Although 1 in 6 prescriptions in our country are used off-label, but forever this
Right.
one they won't allow it.
that. Wow.
And then there's S-ketamine, which you can get your insurance to pay for.
Which is
Spravato.
Spravato.
Yeah, Spravato. Yeah.
And they both are just wonderful, wonderful medications that will change, reshape, and even can save people's lives.
Yeah. It's interesting because I've also been on a slew of different medications, right? I've gone from the Prozac to the Cymbalta, the Effexor, all the way down to Lamictal, Seroquel, olanzapine. I've been on all of them.
I haven't even heard of some of those.
Yeah, it's been a journey because I feel like I also am in recovery from addiction.
Okay.
I have severe history of addiction, fentanyl abuse, all of that in my past. And I feel like every single time I stepped into like a treatment center, right, the doctor's like, here's 300 milligrams of Seroquel, right? It's going to put you to sleep. And then here's like something to help your mood. And I was like, I'm just coming off of these drugs, right? Like I'm unstable. And I think it's interesting because a lot of people do actually need those medications, right? There's some people with severe bipolar disorder. There's some people with severe schizophrenia that need some of those medications. And I think it's confusing to me going to a provider, right? And I'm like, hey, this is what I'm struggling with. I've got, some trauma and, depression. I'm obviously numbing my emotions. And they, instead of thinking outside the box, they, continue to throw medications at it and then I get weight gain, right? Like I gained over 140 pounds on some of those medications.
Yeah, olanzapine.
Yes.
Just looking at it will make you.
No, that's one of the reasons why I gained so much weight is because I blew up. I would take it and I'd gain 12 pounds.
Yeah, because it affects your metabolic system. It has terrible metabolic side effects.
It's horrible.
And did it help you heal and get better and feel better and become yourself again?
I felt like I was
Worse.
like a zombie.
Yeah.
Like you could
It's
see
blunting.
glazed over
It's
my
so
eyes.
crazy.
It was
Like-
very, very scary. And obviously I was like taking it mostly to like sleep because again, like it made me sleepy. But it just, I also have tried Velar. That like made me have like severe like
Twitches or
twitches,
dystonic?
yeah,
Ooh.
like
dystonic
in my
movements.
back, and like I was like I couldn't sleep, I couldn't move. I was like I don't know what's going on with me, and I realized like, and again, addiction, right? The substance abuse, the whole problem, and like we've got to be careful with this. I tell the story to everybody because it's my experience with ketamine, and I didn't know, of course, that ketamine could be helping depression, right? I thought it was just something that I've got to get through or power through or like get sober and like go to therapy, which all those things are really important. But I was severely suicidal and I went to the hospital in San Diego, actually. I went to Sharp.
Okay.
And I was extremely suicidal. Ambulance took me there. I was like 5150. This provider came in and he was like, what's going on? Tell me what's going on. And I was like, look, I lost my grandfather to leukemia suddenly about 3 weeks ago. Flew home to Indiana, came back, California. I'm strung out on fentanyl. I'm strung out on Xanax. I tried to get off of it, had a seizure. I'm not doing well, and I want to kill myself. And he was like, well, the only thing I can give you is ketamine right now. And I was like, okay, great. You know what I mean? I was like, I was like, love this doctor. This is the best doctor I've had. And I didn't understand why he was doing that. I thought he was either doing that to like sedate me and get me to calm down. But it's probably one of the reasons. But it was also because I had suicidal ideations.
Yes.
That was the real reason.
Off.
100%. Obviously it was a very high dose. It was an intermuscular amount.
Okay.
It did it in my butt, and like 2 seconds later I rolled over and I was like you know what I mean? Like I knew where I was, like I was functional and everything. But after that, I was able to walk out of the hospital, like pack up my stuff, figure things out, and like I had the strength to like go and move. It gives me goosebumps.
Wow.
I so wish I can get in contact or find out who that doctor was to like thank him, because I truly think that he saved my life that day by administering.
Was it Dr. Bacchus?
I don't know who it was. He was a
Younger
white
it wasn't.
male with blonde hair.
Okay.
But he was definitely a provider and sharp, and he I know, yeah, like I still,
if you're out there and listening, you saved Kyla's life.
thank you. Probably look very different now, but yeah, like I still couldn't, you know, of course unfortunately I didn't get sober right after that, right? But it did give me the strength to at least not end my life. And I think that's more of a prevention and harm reduction than looking at it from like, well, you know, you just got to detox her and throw on some antidepressants or antipsychotics to get her stable. But that really did help. And
well, it really like rewires your brain, right? Like it kind of like restructures everything. And
so I like to describe what ketamine allows the brain to do. It works on the neurotransmitter glutamate, which like 98% of the neurotransmitters in our brain are glutamate. Like only 1 to 2 are serotonin. That's why serotonin receptors don't really work. SSRIs. It allows, so there's a surge in glutamate, which allows BDNF to be released, which is called brain-derived neurotropic factor, which is a long, big word, but essentially that starts rewiring the neurons in your brain. So almost like if your brain was a city, over time, depression, trauma, stress can causes like potholes or broken roads in that city, and ketamine allows the body to come in and fill in the potholes, fix the broken bridges, and so the communication can go through, and you start feeling better rapidly, and then it just gets better over time. And I've had 3 patients this week say that ketamine has saved their life.
Wow.
Because it turns off their suicidal ideation. It turns off those dark, intrusive thoughts that you can't control, and the more you try to control them, the darker and the faster and the harder they come in. It just turns it off, and they're able to have peace. They're allowed to just be in the present moment. And it just really gives me just so much fuel and passion because I found a way to help save people as a nurse in an outpatient treatment setting versus like, you know, in the hospital, which was very hard for me and my soul and, you know, my sensitivity levels.
Of course.
Can you like take us back to the beginning and like maybe tell us a little bit where that passion came from, and then what ultimately led you to opening your own clinic?
How far back? Well, started here in LA. I went to UCLA to get my master's in nursing. That was like the best 2 years ever. But even before I got out, I was already kind of getting slightly burned out. I worked at Children's Hospital Los Angeles.
Oh, man.
It was pretty gnarly.
I would say that's going to be tough.
It was very tough. I was very traumatized. I also worked in Van Nuys at a hospital doing labor and delivery and PICU stuff. And it was just too much for me. I'm a pretty sensitive, empathic person. And, you know, seeing children, you know, suffering is pretty rough for me. Bunch of stuff happened, but then I ended up getting into aesthetic nursing, like Botox, laser, stuff like that. Super fun. I know, right? So I started a med spa like January 2020. So 3 months later, we're in the pandemic. It was kind of cool. I was able to like work from my house and have friends come by and we would do fun stuff, you know, during the pandemic.
Botox parties,
Wait, that's so fun.
Like, you know.
I want to go.
Yeah.
I know. It was pretty fun. It was in my living room, my little device.
Love that.
Then I started helping a colleague start his own med spa. He's like, why don't you come work at my ketamine clinic while I'm like, what? Like, that sounds weird. What is it, like a trap house or something? Like
I'm
what is
dead. So your initial reaction is kind of like,
like, what are you talking about? This is in 2020,
That's
you know.
so funny. Trap house is great.
Sorry,
What are you
sorry.
talking about?
I should not say that.
No, I mean,
hilarious.
that's your initial reaction.
Yeah, a lot of people react
especially
that
back
way.
then. I'm like, ketamine, like what? Like,
Yeah.
What are you doing? Yeah.
and so I go in and I'm like, this is really weird. Like, we're just like taking people on these psychedelic journeys. Like, what's going on? Like, looking around, like it's dark in there, you know.
Never saw this in med school.
I
You know?
know. But then I just watched healing after healing after healing.
wow.
I watched the most profound was an adolescent girl who was like in her 16 maybe. She had been actively trying to commit suicide for 2+ years, like in a residential treatment center for 2 years. Her parents did not know what to do or how to help her. It was so traumatizing for everyone involved. She kept cutting. By the third or fourth one, like, you know, I go in the back with the patient. We go on the little journey together, and like at the end, like they could hear her laughing and giggling with me, and they at one point walked up to me like sobbing, like, we have not heard her smile like that in years. Like,
Oh
thank
my
you for bringing
God.
our daughter back.
That's so beautiful.
I know. And she got better after like 6 treatments.
That's incredible.
I know. I
That
have
like
the
makes me
chills.
want to cry.
I know. I literally was about to like, I could feel like my eyes watering
Yeah, I
up
have
right
the
now.
chills. I get it to and I, not making this up. Like, I can think of the girl. Like, it literally
Yeah.
changed the entire trajectory of my life.
Yeah.
You're a healer.
I was like, yeah, I got to do this. Like, cool, we're onto something here, you know?
Yeah.
Then, so after like a few thousand treatments, I'm like, okay, what am I doing to people here? You know,
Yeah.
I need to experience this myself. Like, I'm watching them heal.
Yeah.
yeah.
So they allowed me to try one. I go on this beautiful, profound journey. I come back and I look around and I'm like, we are doing this all wrong. And again, entire trajectory of my life is now changing. I start building my own practice. The first business I launched is a clinic in San Diego called Luma. I was partners with a psychiatrist. Didn't want to be a partner anymore.
Understandably
And then
so.
I went through nurse practitioner school, finished up my school, and then I launched my own practice, Velara Wellness. And I could do everything my way.
Yeah.
And I could help people heal in
Yeah.
a beautiful, luxurious, spa-like, comfy, cozy, like...
It's
Yeah.
so gorgeous. It's
Yeah.
so nice.
I've seen some of the videos.
Yeah,
I know. I was like,
we went for a visit, I think 2 months ago.
February?
Literally felt right at home. I was like, oh my God, like the energy,
stay
the
here,
warmth, you are like accomplishing that goal of like beyond 1,000%.
Yeah.
And you're healing people. And I do think like it's all about the environment, especially with psychedelic journeys
Yes.
or psychedelic like journeys. It's like if you, I don't want to relate this to like psilocybin or mushrooms or anything, but some people do mushrooms at like festivals or like in their own house, or like they like just go out to the bars or whatever. It's like you're gonna have a totally different experience
Yeah.
based on that. And I think that, you know, with drugs or medicines that help or like kind of rewire your brain or like give you a journey, it's so important, the environment,
therapeutic environment is so
The
important.
set and setting.
Mhm.
Yeah.
So you're the intentions that you set
Mhm.
and the setting that you're in
Yeah.
are just as powerful as medication.
Yeah.
Although I do like to tell my patients, you don't have to have this crazy psychedelic spiritual experience in
Right.
order to heal.
Right.
As long as you're getting 0.5 milligrams per kilogram into your IV, it's
Yeah.
going to start relaying and regrowing the neurons in your brain. We
Yeah.
just have to, the setting, the intention setting
Mhm.
is so important, because like as we're regrowing those neurons, we want them to be positive, happy,
Right.
loving
Mhm,
thoughts.
mhm.
Yeah. And you want to be surrounded and just comfortable. Like I wouldn't
Yeah.
want to, a lot of the women that come to me, and even men, I have a lot of veterans
Mhm.
with a lot of trauma, and like
Yeah.
you kind of are going into a comatose like state. You're not comatose, but like you're kind of almost going to a trance like state.
Yeah.
And for especially people with sexual trauma and stuff like that, it's probably it is very scary
Yeah.
to like allow like someone else to be there while you're not in fully control. And so it's been told it's very comforting and comfortable to be in a comforting place when that happens,
100%.
especially when so you're not getting traumatized while trying to heal your trauma.
Yeah, 100%.
So when someone is going through a treatment, do you obviously still have thoughts and stuff, but people kind of describe it like you have something, you sometimes feel like you meet your like people who have passed away, loved ones. You see trauma unfold. Like, I guess I'm confused because I don't know. How does it, are they in thoughts? Do you have images? Is it more so like a feeling? What does that process really look or feel like?
Yeah, so people ask me like a few things. They're like, is it scary? Like, no, it's not this scary, chaotic, psychedelic experience.
Right.
I've done over 3,000 of these journeys. Most people describe it as deeply profound, beautiful, and even spiritual experiences. A lot of people do say that their passed on loved ones and their ancestors come to visit them.
Yeah.
Some of them can see images of them. Some of them just feel presence. Some of them see light orbs. Like, a lot of people will ask me if I turn on the lights during the treatment. And I was like, no. And they could see lights coming through their eye shades.
That's beautiful.
And then so I get the chills.
That's so
It's so cool. Like, when I had to take a break in between businesses, like, I missed my patients because I always say they kind of become like these direct vessels to the spiritual realm. And they say the coolest things.
That's awesome.
I've had a patient wake up like this and he goes, I'm where all the souls are.
I just got goosebumps.
I know.
Wow.
I would have been like, okay.
I've had one girl like,
supposed to be.
There's 2 grays and a mantis with us right now. I was like, okay. I know.
What?
I love that.
That's incredible.
Well, the universe is beyond what we can see.
I know, right?
And people forget that because they're so caught up in their own lives and what is
3D
projected towards us. Yeah. It's like
there's a whole other
And so
dimension.
so ketamine is a dissociative anesthetic. Your consciousness, as doctors would put it, or your soul dissociates from your body, so people can have out of body. They can see themselves.
It's
down.
an out of body experience.
Yeah.
nauseous.
And then so once they've dissociated who they are, their consciousness, their soul, whatever you want to describe it as, if you're a doctor, whatever, can then go fly through the universe.
Yeah.
And
Astral
they do.
project, right?
Yeah,
That's
I mean,
kind
so
of
many
what that
people,
means.
so many people describe it as, I was in a spaceship. I was in a rocket ship. I was flying through the universe. I went to this solar system. How can they make this up? Like, they don't talk to each other.
Yeah.
You know?
And it's similar experiences.
Oh yeah,
right?
like you could see some of them like they're almost like you can see G forces in their body.
I love it. That's fantastic.
I never had tried ketamine previously before that experience, and so I really had just heard like, oh, K-hole, party drug, that same thing. I tell you what, buddy, that was a journey that I had. I was, again, in a hospital room, seeing myself lay in the hospital bed and be like, this is unacceptable. Like, talking to myself and like having a conversation with myself profoundly and being, yes, there were elements to like a whole of some sort, right? Because I felt like, but like the world around me was going, I have goosebumps right now, but like where I was at, like I was leaving while the world was like running past me in this like trajectory that I was going, and I was able to look back at like myself, and it was incredible. Again, I really have goosebumps right now. Like I feel sick to my stomach, but like to be able to like look back and be like, there's so much more that you have left to continue on, and it's not over. Like you just got to get through this hard part, and once you get through it, it's going to be worth it. And thank God, because look where I'm at now. You know what I mean? Like, thank God. But it is people ask me all the time on the phones when I speak to patients. They're like, am I going to be high? Or like, am I going to be in like seeing monsters? And I'm like, I would honestly probably just describe it as like a euphoric disassociative state that can be powerful. Some people find it comforting. Some people find it warming. It's like, it's not scary. But it's incredible that you have not only healed so many people, number one, just have taken this to a deeper understanding of like, it's not just medicine, right? It's not just medicine, but you're really truly healing people and watching people like walk these journeys and heal.
Yeah.
It's absolutely incredible. Like, kudos.
Thank you.
Seriously.
Starting this second business is like my baby. Like I think I've worked probably like 17 days straight the past 17 days, and like this is my Saturday, but I don't care. I'm energized by it. It's my passion. I want everyone to hear about it. I want to start teaching other providers how to add it to their practice so that more people can heal, because I'm not here to just give you a script, see you in a few days, tell me how many side effects, or can you live with these side effects, you know, and I'll see you later. Like I want to heal you on a molecular, cellular, soul level.
And you know, I just watched a video recently of, it was filmed probably, I would say early 2000s, late 90s, where they asked all these psychiatrists and like mental health providers, how many patients have you healed? And they were like, none. I don't think I've healed a single patient.
I've seen that.
Really?
Yeah.
That gives me the chills, because I've healed 3 in the past week.
And that's,
I've had
Wake it up.
healed.
Wake that up.
I've had a patient with a plan.
yeah.
Not intense, but a plan, and Spravato. This after the second treatment, better. Didn't think she can get better. She didn't think she could get better. I know that she could, but yeah, you were mentioning something about your experience. A lot of people, it is sometimes hard to describe. It is ineffable, I say. It's like there aren't really words to describe it.
Yes, it's like almost like God. Like I don't want to bring spiritual. Like it is spiritual. I don't want to bring like a level of faith or like God, but like it's an all essence of like, I can't describe what the afterlife is like, right? Like I can't describe that. That is what that was like for me. And I don't have the words. It's unfathomable of what ketamine the experience was for me.
So, and what I've seen for especially my acutely suicidal patients, yes, they are getting a medication into their vein that's helping their brain heal. And we can't study this other part I'm about to talk about, but I've watched it happen. You've almost touched on it just in your experience. If you never even heard me say mine, but most of my suicidal patients come back. They've seen in some way like almost building block, and they all describe it similarly but different. But some people see building blocks like build the universe and then unbuild, and then some say they'll see it come up and then almost melt away. And then they all say they see why they belong in this world now.
Yes. Yeah.
And then their suicidal ideation goes away.
Yeah.
Like they see how they fit, why they need to be here.
Yes.
And why they need to get better and stay here, and then why they belong on this earth. And then it just does something, and it's almost like you see, you're able to see from like a 30,000 foot view.
Yes. That's what I mean. Like it was like,
so it makes your problems almost look smaller.
Like ant size. Like
because sometimes when we're in our echo chamber, like that's all you hear. It's like just the pain, pain. You go up there, you're like, oh, there's a lot around. It's like,
yes,
I see.
Yeah.
Okay, like let's just turn off those voices, like quiet them down, and like let's just go do cool stuff and experience life.
Yeah. No, I really think that was a great way to describe it. Really good way to describe it, because it is so much all at once. Like you're experiencing so much in that moment, or like the moments that pass. I don't even know how long it was, honestly.
Yeah, so time doesn't exist up there.
Yeah,
because you're dissociated.
Yeah,
you're
totally. Was
literally.
Gone. I was probably 4 hours.
They'll literally come back and be like, no, it's only been like 2 minutes. I'm like, bro, it's been like an hour.
Wow.
Because they go out of the 3D realm and there's no time up there. It's really crazy. It's really cool though, and I highly suggest.
It's so beautiful.
It is. It's a very, very.
How insane is it that like people who have never spoken to each other, never met, all experience very similar things?
Yeah.
That's like we're connected beyond.
Oh yes.
Yeah.
Beyond. There's like a.
Yeah.
It's like in the Matrix, except I don't believe in that. I believe in humanity and spirituality.
100%.
That's amazing.
And I'm glad and so grateful that I was able to find this blend of like, because after kind of almost having a little mentee bee when I got out of nursing school, like what are we doing to people in hospitals right now? Like we are not helping them. Like we are hurting them.
I know.
We are not healing. I'm like, I don't want to be a nurse anymore. I just want to be a travel blogger. Like I can't do this. My parents are like, you just went to UCLA for your master's in nursing. You need to be. I'm like, no, I'm not doing this. Like this is not okay.
Corrupt.
Yeah.
It is a
And
it's a
so
message
I was
system.
able to be led to this wonderful medication that I think is the largest breakthrough in mental health care since the invention of Prozac.
Yeah.
You know,
Or the lobotomy. I mean,
Uh-oh.
you know, I mean, God, it really has like put us up, I would say, just a couple hundred years at least.
Light years.
Yeah, light years, really,
I
truly.
mean, yeah, I just wish that like a few major stories like didn't take all of like
I know.
Do you think it's on purpose? Like, I think people...
They
I
want us to
mean-
stay sick.
Yeah, so that they can
'Cause
keep
people make
writing
money.
scripts and
Yeah.
make money.
People make money off
it's
the
forever.
meds.
It's forever.
Forever.
Yes.
They're going to bill your insurance $300 for that 15 to 17 minutes for the next
Session.
however many years you're on.
Yeah.
Yeah.
I'll have 74-year-olds come in on SSRI, Wellbutrin, 2 antipsychotics,
Yep.
trazodone, like in a sleep aid, and I'm just like, excuse me, what?
Why
They
does
should
grandma
not
need all
be.
that?
Yeah, why does
Grandma does not need all
Grandma
that.
does not need all
Yeah.
that.
No,
I was
it's
just gonna
dangerous.
ask you if you had heard this because was reading something that they're starting, or some places starting to utilize ketamine for people who are in like hospice care.
Mm-hmm.
So people who are struggling with the thought of leaving, right? Because we know that they are coming to their end of life,
Mm-hmm.
and that instead of putting them on like opioids, morphine to numb them out, and just be like that they're giving them ketamine, right, to help them process what's going on
Prepare.
with them and process the thought of passing on and having them be at peace. Because number one, it
so
helps with
beautiful.
pain, right? It helps with pain, and it helps with all these other elements. And they obviously need pain meds because they're whatever they're dealing with. So I find it interesting that it's not only helping, you know, that, but also helping people cross over
Yeah,
and feeling
during
at
life
ease,
transitions.
life transitions, and
That was chill.
that's I mean, I think that's beautiful. I
So
think
yeah,
that's needed.
I haven't heard of that, but I think it's beautiful, and I would love to look into that and even help people with that. You know, I think that sort of transition is difficult. It's not talked about. It's not honored in this country.
Like a doula? Is that what it's called?
death
Like a death doula?
Yeah.
I guess it's kind of like a modern day
Yeah.
version of that.
Yeah, and because it does give them that sort of. So a lot of people feel when they're first trying it, like some people say, "Am I dying?" But that's what it feels like when your soul leaves your body. So when you're
Scary.
dissociating,
Sorry.
it can feel like that. But like, I'm here, I'll hold their hand.
Yeah.
I'll like, let's go back to our breathing or whatever. And then once they're like, okay, then then they're fine and they go, you know. But
Yeah.
there could be that a little bit of anxiety, which is totally normal. And it does help us with letting go, giving our issues, our worries to God, spirit, universe, just giving it to a higher power. And that helps a lot with my patients. Like we can't control everything. Like we have to give this stuff away. Sometimes it's just that letting go that they need to work on.
You know, after this conversation, I've been really going back and forth on whether I should try again with the treatments, because I've been struggling with just a couple of different things. And obviously I'm not in that bad of a place anymore, thank God. But I've really been like, should I do it? You know, like I've got X amount of time. So, you know what I mean? Should I do it? Do I do it? Like, is it wrong if I do it this, you know, whatever. But I think at just having this conversation with you, I think that it's worth trying. Pearl, you're like,
Yeah, come
stuck.
over. Come down to San Diego.
I would absolutely love to.
I was just
Nick,
thinking
I
that.
wanna say-
No,
No,
literally.
we're getting in the car
I
right
just
now.
had that thought. I was like, I wouldn't want to go anywhere
And I
else.
literally just
Like,
said that. I was like,
seriously.
yeah, I probably, I mean, yeah, I think I would be definitely open to it, because I've always been afraid of it again, because I've been like, I don't know if I'm in the right space. Are you okay, mamas? Oh, you just want to pet it.
Well, yeah, you guys should come down. You know, and if
Seriously.
you are
Yeah.
a medical candidate and it's safe for you to get it and it's medically indicated, then yes,
Yes.
we can do it in
Of
a very
course.
safe and
Yeah.
controlled
Of
environment.
course. Yeah,
Yeah.
yeah, yeah.
So I went to this wedding and there's a female doctor there that I had actually grown up with her, and she was telling me, I didn't know this yet because I hadn't been in the hospital probably since nursing school, since 2015, 16. They are now using ketamine on the hospital floors instead of pain pumps. So the people that just out of surgery, they would literally have a pain pump and they can give themselves morphine, dilaudid, like very strong pain meds. And they're not using
To
that
themselves?
anymore. Yeah, to themselves.
Oh.
You can push it a million times. It will only give you a certain amount.
Got it.
But still, they're on very high doses of fentanyl, dilaudid. And now ketamine is being used and it's reducing their pain more. It's allowing them to, when you're on that many opioids, like your bowels stop moving and it's very dangerous. So like they're able to go to the bathroom. Like they're just, it's even changing the way we are doing medicine in the hospitals, which is really cool.
Wow.
Yeah.
That's
because it actually works. It takes away their pain. I have a patient. He's a veteran, a Marine of like 30 plus years. I don't like to say he was addicted to opioids, but he says that. But like usually when you have insane back surgeries, like you just become dependent on them because of how strong they are. He couldn't even bend over to put on his socks and shoes. And now with ketamine, he is at a 0.
wow.
His pain is just gone.
Why isn't it marketed towards that?
It is chronic pain. You asked me
For
earlier.
for
I'm
IV,
like,
right?
I was like, oh, there's something I'm forgetting. But yeah, chronic pain.
But not Spravato.
No, it's not high enough doses.
Okay.
Yeah.
But they influence each other, depression and pain.
Yes. So when his pain is being aggravated, I'm like, what's going on? Like mentally, you know, and he's like, yes, this, and this is happening. So yes, I never tell anyone like pain is not in your head, but it's psychosomatic where like your emotions can influence them and make them worse. Cause we can just, if we're stressed and anxious, we'll just tighten up in general. And then our muscles are tight and tight and there's nothing we can do, or even our stomach is tight. So then we get stomach pain or whatever.
Yeah.
So if we can heal our traumas, heal our emotions, we can heal a lot of our physical ailments as well. Yeah. Yeah, it's pretty crazy.
It's so profound.
It is. I love it.
Love it. What advice would you have for somebody who is looking to start their own clinic? You
can do this. It's going to be hard. It's not going to be perfect. But you can do hard things. We can all do hard things. I have a little sticky note that says boss ass bitches must do hard things.
Period.
But like the world needs what you are building.
Yeah.
And you know, yes, I have made some terrible mistakes. Like my first website was a $10,000 mistake. I got ripped off by a friend.
That's
Visa helped me get $4,000 back. They took him to arbitration. Now focus on just moving forward. I learned that lesson. I'm going to have, you know, I didn't have strict deliverables before I keep paying. So now I learn like, you know, now we're kind of a pain, you know, we're not a pain, but like, I'm just learning to be a serious business person.
Yeah. As you should be.
Yeah.
Yeah.
I need to be a serious businesswoman because we're doing serious things. And yeah, I just want to teach and spread the word about this medication, and also TMS though too. Ketamine, S-ketamine, TMS does work as well. Has similar efficacy. It takes a little bit more time, but there's no medications involved for those that are afraid of having a psychedelic experience.
Yeah.
But yeah, it's pretty cool. I think, yeah, it's very strange. People ask, how did you get into this? I'm like, God. Or universe. You know, there's no avoiding it. And I think, yeah, interventional psychiatry is the future of psychiatry. The future of psychiatry isn't pills. It's not, here's your next prescription. I'll see you later. I don't care about the side effects. I don't care that you're not going to want to have sex. You can't have sex. You can't have an orgasm, and you're going to gain weight. How's that going to help your depression?
Who wants that? Nobody wants that.
Nobody wants that. And so, yeah, ketamine, it does. It's a time. It's 6 sessions. Spravato's 8 sessions, and then maintenance after that, once a week, to every other week, to every 3 weeks, to every month. But you have to get a ride afterwards. But imagine those small things, and then you're feeling better. The grass is greener. The sky is bluer. You want to do things.
I think that was a really great episode.
I wanted to kind of say, like, if you like, because sometimes it says like it seems hyperbolic, but I say like it saves people's lives. But like 3 of these patients in the last week, like they've even written Google reviews where it's literally saving their life.
That's what your conversation, like you having like, I don't think any provider that we've spoken to yet on the podcast has like addressed it the way that you have, and like how it's changing people's lives. They've been like, yes, it's effective. Yes, it's like science, facts. But you saying like in a human way, right? Instead of being like a provider of like neurotransmitters, which you did all of that, right? But you still also had a human component to it, to where you were like, I've watched it. Like, I've seen what's happened in the actual chairs and like what people are experiencing. Made me think like, okay, my experience wasn't dumb, right? Like, that was a true experience that I had, and then I would benefit from it again, you know? And I think that's especially huge coming from a provider that you're treating patients, because that's what they're looking for. People look for that in providers.
And I have seen like well over 3,000 of these. It's not like I'm making and a lot some providers have just kind of read about it. But yeah, I come from a very real, and it's just so cool. I'm so passionate about it.
Also, some of them don't believe in it either.
Yeah, because they're still so regimented.
It's really hard.
They're probably
to
just doing it for the money, but like,
I know, and it's not helping anybody.
Yeah, because it's an energy. Like, I know it's hard to describe, but like, and I don't care if people think I'm weird or different, but like,
no, you can feel it with you. Like, seriously,
it's
for
true.
real.
It's intentions.
And like, you are a healer.
It takes a lot to convince me too. Yeah, not easy to convince, but that was like, I was like, maybe I should give this a second shot and think about it. And I really, honestly, with some of the providers, you don't want to do it with them. Yeah, that's what I was saying. Like, you don't feel safe. It's not that you don't feel safe. It's that you're kind of like, is this guy this person have the best interest in me? And like, or is it money? Is it like there's something else going on?
If some of these people came into the room while I'm dissociated, I would get spooked. I would be scared. Yeah. It is like I feel like it's not holistic healing, but it's alternative ways of like, you really have to believe in the spiritual and like human aspect, as you were saying, to really like
understand it.
Understand. Yeah. So thank you.
Yeah, so thank you. Yeah. Thank you for having me.
This has been great.
Yeah, this is awesome.